Hi, my name is Brianna Hall, and I am the Director of Development for Medical Billing Center. Today, I'm sitting down with Adam Baliatico. Did I say that right?
Yeah.
Perfect. Adam is the co-founder of Prompt. Everybody who is watching this knows Prompt, I am sure. I always like to tell the story of my very first time attending PPS and right going and being kind of new to the industry, new to my career, and seeing Prompt and in your beautiful, exhibit there in the hall, but also the jumpsuits are like my favorite talking point. I'm like, they walk down the hall in their red jumpsuits and everybody stops to be like, oh, how cool. So yeah, that's your company. How does it feel to kind of be the it company in the industry?
I mean, it's never, that's not the main focus. It's definitely fun to, go to PPS or events like that. And, I mean, when Mike and I started Prompt and we went to our first PPS in 2019, we had to beg people to talk to us and no one knew who we were. So that's definitely nice. But I mean, it's just a testament to the work that our team does every day to try and create value for our customers and help the industry excel. And I think, that's really our goal is to drive extraordinary outcomes for rehab therapy businesses and their patients. And as long as, we're going to go to PPS and it'll be fun and, people will recognize us as long as we're doing that. So it's just good to see that always. And obviously we have so many customers at PPS every year now that, it's like half Prompt customers and it's fun to be in person with all of them.
Yeah. I was just listening to a Jay Shetty podcast with a club owner, so totally different industry, but his main kind of focus and how he's been successful in his career is exactly what you just said. Add value. If you can add value to your customers and to the industry, right, it's going to be relevant and it's going to be important to people. Talk to me a little bit about how you got started in the physical therapy industry with your partner, that's Mike Dwyer, right?
Yeah. So Mike and I, we've known each other since we were 5, 6 years old. We've had a
Oh,
couple
cool.
businesses together before. They were, landscaping businesses, driveway sealing, stuff like that. But we were seniors in college. We had both spent a ton of time in physical therapy. I spent the better part of 4 years in and out of PT for primarily ankle and calf injuries. Mike was actively in PT for a slap tear. His senior year, and he had had a couple of years of PT related to compartment syndrome. And we're very analytical people. We were finance majors. I went to Boston College. He went to Providence. And he was up visiting, and he said, I've been tracking my recovery on an Excel spreadsheet and graphing it because all the therapists would take the range of motion measurements. They'd take those measurements, and at the time they would type them into their EMR, and it was kind of a black box. And we wanted to be able to visualize our recovery. And we had also learned that 7 out of 10 patients weren't completing their plan of care. So we felt like we could solve a pain point there. We did very little research. We just said, we know a developer, a friend of ours, we'll pay him to build an app. Prompt stands for Personal Range of Motion Physical Therapy. Built the app. It was going to track recovery and help drive plan of care compliance using all the objective data that a therapist would track. We actually went to sell that product when we graduated college. We decided not to take jobs on Wall Street. And for about a year, 200, 250 practice owners said, that's a cool idea, but we're not going to use that product even if it's free. It wasn't integrated in the EMR. It would be an extra piece of documentation that the therapist had to do. And so even though it could solve a problem, it wasn't going to be useful. But one thing every owner said, they basically said the EMRs in the space aren't serving our needs. They're a cost for our business, not a value driver. And if you could build a truly all-in-one platform that solved the needs of all of our users, our therapists, our admins, our billers, and our patients, we'd be really interested in that. And so we kind of sat down in 2018 and said, do we want to go work on Wall Street or do we want to start this company? And, it's going to be a lot more work than building a patient recovery app. We decided to do that. And it was actually like right before COVID that we launched our product.
Yeah, That's what I found when I was researching your guys' company. Now, tell me this. So it sounds like you had a little bit of a start as a serial entrepreneur throughout college. Is that
Y-
accurate?
Yeah, I ran a sports. I was the Boston College like lead sports writer. We had a landscaping business. I had a full-time job in college too. But yeah, my dad was he owned his own company for 25 years and still
Hmm.
was always starting businesses.
How have you been able to stay focused on the goals that Prompt has currently?
Yeah, I mean, Mike and I set out like from day one, and my brother Evan is our CTO, and we were like, if we're going to do this, we have to help therapy owners run a better business because ultimately we felt like part of the reason why this patient turnover was high was because the business side wasn't optimized. And, so the goal was always from day one, help the businesses and help the patients. And like that's an easy mission to align around. And it's something that, while the way to solve that problem changes year over year, and the biggest pain point for a practice owner back then was referrals, believe it or not. And
Hmm.
then it became optimizing the schedule, and now it's hiring therapists. Like the needs of the
Yeah.
business change, but the idea that we as a company need to both build software and also do other things to help run a better business and provide better patient care, like that's never changed and that never will change, no matter how big we get.
What's really interesting to me, and I wrote this down as one of my, talking points, was I worked as a patient care coordinator in 2019 in a physical therapy clinic. So working the front desk, doing patient scheduling, educating them on their benefits, doing prior authorizations, having those conversations with patients. And so what I'm noticing in my role today and in how I help practice owners today, some of the problems are exactly the same. They haven't shifted, right, in 6, 7 years. What do you think? Do you think in the age that we are in AI and with all the technology that is in the industry currently, do you think in 5 years we'll have the same problems and we're just solving them in a different way as we are now? Or will the problems be different?
I think the fundamental like business of physical therapy is probably it's going to change a little. I think some of these value-based care contracts shift, but like at the end of the day you still need to get referrals, convert them to patients, schedule them for visits, get them better, and then get paid for your work, right? Like that business model is probably not going to change in American healthcare for decades or whatever it may be. So the core business operations will be the same. How you solve the problems and which problems can be solved by technology. I think that's where it's shifting really rapidly. AI is obviously a big part of that story. I think there's also you have to be very cautious of like when you're buying an AI solution. One, is it really AI or is it just offshore labor represented
Mhm.
as AI? Two, does it actually solve a problem or are you just adding expense to your business because it seems cool? So like there's a lot of great things we do with AI, and there's a lot of great vendors that have like point solutions for a specific need with AI, but also there's a lot of um, stuff that can potentially harm a PT practice
Yeah.
with some of these solutions. So it's a thing to be careful about, but it definitely helps accelerate some of the problems. And then for us, we now have like end to end from the first minute that a patient finds your website to like the last minute that they pay the last penny on their account, and like every interaction and journey in between. So we're able to do a lot of really cool things both with AI, but also just with using all of that data to be able to automate repeated business processes. And that's
Mhm.
something we've been doing since well before like the AI revolution.
Systems, right? They're so important. And it's so easy for a system to fail. I think that that's a little bit of human nature that we know what we should be doing, we know what we're supposed to be doing, and then things slip for whatever reason. But having a solution, right, like Prompt or a fully integrated system, like you just said, end to end, measuring all, getting all the data for you, then you can use that data to continually put in place the systems that work.
Yeah, we're really trying to be like the full operating system for a rehab therapy practice. So I think that's a shift from historically there's been like EMRs, billing softwares, marketing softwares, like patient engagement stuff on top of it. We're even looking this year into like payroll integrations and like we've built a chat platform so you can centralize your communications, like building a phone solution, being the true single like operating system, like Salesforce is for a software business. Like you can run your entire business on prompt. And I really think to build great AI solutions, you need a back end operating system like that can be the one stop shop, because otherwise you're just going to be plugging AI things into a messed up core system. And I
Mhm.
think that actually can make a lot of problems worse versus actually solving them.
AI is only as good as the inputs that you put into it,
Yeah,
right?
Pedro,
So,
our VP of AI, always says, garbage in and garbage out.
yep, that's right. Okay, let's talk myths versus reality. I feel like I could pick your brain for a long time, but I know your time is limited. So, one of the things that I really wanted to ask you is I recently saw a post on LinkedIn, and the gist of the post was that all EMR companies, so not specific to yours, all EMR companies want or need practices to stay in network with traditional insurance. Would you agree or disagree with that statement?
It doesn't matter to us. Like we've built out a ton of cash pay solutions. We're actually about to launch like cash packages. And I think our job as the vendor and having access to large volumes of data is to guide our clients on bad contracts. And that's actually one of the things I think we'll do with AI here in the coming months. But already we're just doing it in our business reviews with our clients and saying like, hey, this contract is only paying you $70. Your labor cost is $80. Like, why would you be in network with that payer? And so actually a lot of I think more than a third of our clients dropped at least one payer contract in 2025. And for us, if you can make more money and run a better business and still give that great patient care in the out of network model, you should do it. And honestly, with how high like the patient responsibility has become on a lot of like in network plans anyway, a lot of times the patient is
They're
maybe
already
not even
paying
worse
out of
off.
pocket.
Yeah. Yeah.
Yeah, exactly. I know it's one of the things that we look at, right? We have two boys, and so we have a family of four. And yeah, once we meet our deductible and we pay all of our co-pays, we could just pay cash all year
Yeah.
and probably be in a better spot because we don't really go to the doctor.
Yeah.
Um, okay, yeah, that was a great answer. So you guys are fully supporting out of network and cash-based practices.
Yeah, I think you really have to at this point. Like, so I think, PT can't abandon in network. Obviously, it's going to be a huge part, but like, if Optum wants to pay $60 a visit, well, then we'll just go out of network with Optum. And ultimately, over time, they're going to have to raise those rates to be in network. Otherwise, there's no reason to be in network.
It sounds like one of the myths that I would ask you, and I feel like based on this conversation we can answer it, but your EMR is not just an EMR, right? So joining Prompt, it sounds like you're fully supporting operations, business ownership, how to make these decisions that ultimately lead them to running a better practice, able to probably, you know, pay better therapists, or not better therapists, but pay have better pay for
Yeah.
their therapists, et cetera, and on and on. So the myth would be your EMR company is just supporting documentation.
Yeah, I mean, we rebranded to Prompt Health last year. And obviously, part of that is that Prompt EMR was no longer even remotely an accurate description of what we are. The EMR is a component of what we do, but obviously, with Sidekick, like the therapist spends so little time documenting now that an EMR is an EMR, but like we do the operations, we do all automated scheduling. We have an entire patient engagement suite, reputation management, billing, reporting, analytics, lead workflows, kind of the whole 9 yards. We're going to do payroll, chat, phone systems, like run the entire business in Prompt. That allows us to then use the data to run, our Prompt Insights platform, which gives you really high level intelligence about where you should focus your time to run a better business. And then we have Prompt Compensation to manage aligning the incentives with your providers. We've seen a 35% reduction in provider turnover versus the industry average. I think that's a testament to the operating system we built. Therapists that work at Prompt clinics make more money, they document less, they can spend more time with their patients. And then obviously we also have Prompt Engage for our RTM solution, and just trying to really be an entire ecosystem for our clients, and then connecting with great partners, whether that's RCM companies, coaching companies, some software vendors, analytics companies, like connecting with a great partner ecosystem. We have over 50 partners now as well that help, provide value to our clients. And then another component also is our whole like recruiting and student placement work that we do. So we have a free recruiting arm that's called Prompt Career Connection. We help our clients find therapists. We don't charge for that. We give Prompt away for free to universities, and then have what we call our student placement initiative, last year was the first year we did that. We placed over 3,000 students at prompt practices. And then obviously advocacy is another huge component of what we do, and being in the market and making sure that we're advocating for our clients and in Congress and also at the local and state level.
Mhm. What about like go to market? Do you do any work if a practice wants to have an exit?
So we've started to, and actually we were just having conversations last week about formalizing that, but a lot of our clients are doing so financially well, in the mid-market and enterprise space that they want to buy clients. And a lot of our smaller clients are doing so financially well that they feel like there could be a path to an exit. So it's definitely something we're considering more formalizing. Informally, we've helped, you know, broker, introductions between sellers and buyers, you know, a couple dozen times over the past year. So it's definitely something, you know, interesting. And, if one of our clients wants to sell, obviously there's a lot of bigger prompt clients that could want to buy them.
Now, I know your time is limited, so I'm going to try to wrap up. The last couple of questions we'll do a little bit more rapid fire. So, can you talk to me? Do you think that providers have all of the information that they need when they're doing their note in your EMR to code their claims correctly?
I do, because with Sidekick, we have our intelligent code and compliance and coding and compliance module built right into their workflow. So if they do any miscoding or any of their documentation is not compliant, they're getting a real-time alert about what's wrong and what they need to fix.
Awesome. How does Prompt as an EMR integrate with the clearinghouse?
Yeah, so we have a frictionless clearinghouse integration. We work with a bunch of different clearinghouses, but our goal is you never should log into the clearinghouse. The clearinghouse is a data exchange broker, and we pull in all of that information in a frictionless way into Prompt, so that the end user doesn't need to log into the clearinghouse.
Now, question for you, where do you see an expert like Medical Billing Center, right? We have been providing physical therapy specific RCM services to our clients. The majority of our clients are single practice owners. And we have been serving the Southeast and beyond since 2001. Where do you see a expert partner like us fitting within a practice that uses Prompt?
Yeah, I think so many practice owners don't want to have to manage hiring and maintaining a billing staff and don't have the expertise to do it. And vendors like yourself, like it's a tremendous service that you all provide to give high quality, transparent billing at like great rates and to provide a ton of value to clients, all across the country. And obviously we've worked together for a while and seen that in action. And, some companies want to do their billing in-house and feel like they have the expertise, but I mean, our data shows almost half of the clinics on Prompt still use a vendor, and I think there's a huge need for great, high-quality, transparent third-party vendors, especially ones with deep expertise in the rehab space. Like there's a lot of generalist billing companies that I think sometimes struggle to really meet the needs of a PT practice.
Yeah, I would echo that sentiment. Now, I know your time is limited, so I will kind of wrap up here. But one final question for you, Adam. Who else in the industry do you think I should speak to?
Yeah, I think there's a ton of really, really interesting conversations. One person I've gotten to get to know pretty well is Larry Benz. He has a ton of great perspective. And then I think a few business owners that are really doing impressive things. Josh Funk at Rehab to
Yep.
Perform, Ben Carlson at Carlson Pro Care, and then Dave and Mike Manzo at Atlantic Rehab in New Jersey are three that jump to mind. I'm
Yeah,
making
I got
trouble.
to meet Ben last year at PPS. That was really nice.
Yeah,
So
yeah.
awesome. Well, thank you so much for your time.